today's session is as engaging and as educational as the previous ones have been. I did sense some interest among the people, which is why I came up with this particular topic. So let's hope this is as engaging as the previous ones. COVID, yes, it has been very interesting. Dentistry wise, it's we have not been allowed to practice except for now, from starting June 6th.
Looks like India is going to go another lockdown.
Yeah, no, so we, for lockdown, dentistry was mostly just focused on emergency services. So, if someone had a toothache or a swelling and needed to be
There
taken
is khichdi if you want.
most of it was around just
Fresh khichdi.
giving them prescriptions. Yeah, just prescriptions and, helping them with their immediate need. A lot of dentistry, there's some interesting teledentistry services that have started. Of course, dentistry is harder to do, remotely because you do need to see the patient, take x-rays, etc. But you can certainly do at least the initial visit and help the patient out with their immediate need, perhaps even give a second opinion, etc. So COVID has been very interesting in that respect. Also, as far as today's topic is concerned, why this particular topic in this time? Well, firstly, in some of these emergencies that came up, given that children were at home, given that, they had not much to do, there had been some unfortunate accidents where children do end up hitting their teeth and breaking teeth, etc. So how do we go about now, helping them rebuild those teeth? What is it that can happen with broken teeth? And that led me to this current topic, which is aesthetics, which is why is aesthetics in dentistry even important? Is it important? Does it really matter to everyone? And should it matter to everyone? And such. So I hope some of those questions can be answered. I'd love to make this interactive, as so mentioned. So if you have questions, please feel free to put them in the chat, and every now and then we'll stop to take these questions, and hopefully we can educate you further on this very wide topic. So firstly, let's talk about, since the topic is aesthetics or cosmetics, what exactly does that mean? As far as aesthetics in dentistry is concerned, as a cosmetic dentist myself, what aesthetics is patient driven. What that means is, within reason, if we are not doing harm, what we want to do is give the patient their idea of what looks beautiful on them. Of course, if there are things that are dangerous, then we do speak up. But for example, this person on the left, thinks that a gold tooth is aesthetic. Excuse me. There are certain cultures that think that gold teeth are either lucky or aesthetic or whatever have you. I am not somebody who can tell you what's cosmetic for you. So within reason, that can be considered aesthetic dentistry. Madonna, famous Madonna, it's not that she can't afford to close that gap between her front teeth. It's that she considers that aesthetic or lucky or whatever have you. So within reason, if she has requested her dentist to keep that gap, then so be it. We as dentists are not going to put our beliefs on patients to tell them, okay, this isn't as cosmetic. If someone asks me what an ideal smile is, I'll let them know. But as far as results are concerned, I'd rather base them on what a patient desires. So in short, aesthetics is patient driven. So these two examples are perfect examples of that. What do we as dentists focus on when we talk about aesthetics? For us, aesthetics takes a second stand, a second, it's secondary to health of the teeth and the gums. What do I mean by that? So this picture on the left, for example, they have perfectly straight teeth. So as such, pretty, for as far as the general public is concerned. However, when I look at this mouth, this is not a healthy mouth. They have very severe gum disease, where if you can look, it's very red. These are called swelling around the gums because they haven't had a cleaning done. You can see all this plaque collected. You can see that these gums are very, very red and inflamed. They're swollen. As far as we are concerned, this is not aesthetic. But if you look at this person on the right, they have these pink, nice gums, healthy, clean teeth, and that is considered quote unquote aesthetic in our opinion. So health promotes dental aesthetics. When you have healthy teeth, they automatically look a lot better than unhealthy teeth and gums. So if you were to look at this person on the right, the big difference here is that they've had a cleaning done. This person has not. So just basic would be just to brighten your smile, just to make your teeth look quote unquote whiter. Your basic thing might just be go get a basic cleaning done or a deep cleaning done based on whatever your dentist is recommending. So again, when the dental health is affected is when the aesthetics are compromised. So the very first line of defense for us would be, are the teeth healthy? If they are not, then we focus on that first. Now, let's talk about certain situations where it's harder for a patient to keep their teeth and gums healthy. Let's take this particular example of what we call crowded teeth. What crowded teeth means is that there are way too many teeth that are fitted into a small space. Simply put, your jaw size is sort of smaller than the sum of all your teeth size. So these teeth can't fit into the jaw, so they end up getting all crooked. And as a result of this, so now let's see, when you have crooked teeth, what happens to the teeth in particular? We have this particular tooth that is severely crowded, as it's called, which is it's placed way inside. So if you look, it has a lot of plaque and calculus collected around it because the patient probably finds it extremely difficult to brush that area well. Plus, obviously, they haven't been flossing. So you can see based on the previous healthy gums that I showed you, these aren't healthy gums. These are red, inflamed, swollen. You can see here, they're very swollen. There's another red here. This is what we call plaque and tartar collected. So right off the bat, they are not healthy. Now, my first line of defense here would be, okay, let's get a cleaning done. However, like I mentioned, this person has such crowded teeth that it is practically difficult. It's perhaps impossible for them to keep it as clean as I'd like them to. So in addition to this tooth being crowded and having these gum issues, if you look at this particular tooth, you can see the damage done to this tooth here. It's broken, it's cracked. You see this crack line here. What's going on here? So what happens is that because these teeth are placed more outside than they should, the pressure applied on this tooth in particular is extremely high, and this tooth cannot take that pressure, so it starts to crumble. You will notice breakage, cracks, and everything unhealthy going on with this particular tooth. So and I will talk about what to do in a situation like this. But again, as far as health is concerned, these are not healthy teeth. And as a result, as a dentist, they are not aesthetic. Also, from a patient's perspective, just the fact that they are crowded and broken, it's not aesthetic. Now let's talk about the opposite problem, where you have spaced out teeth. What happens in this particular situation? It's the opposite issue where you have way too much space, and either the teeth are smaller in size or you just have just way too much space. So there ends up being gaps in between teeth. So what's the problem with that? Well, what happens is the way, this is an extreme situation, but I have used this to show you what can happen with spaced out teeth. So if you look at the profile view of this particular patient, you can see that the teeth are meeting at a very bad angle. So these bottom teeth are hitting these top teeth at a very high force. So given that these two, you can see how splayed out they are. They spread out because the bone here and here cannot take that kind of force. So they continue to spread out and spread out and spread out. And you will notice if there are people on this chat listening where they have spaces, they will probably notice that over time the spaces are increasing. And that is happening because of this. Because of the pressure being applied, these teeth can't take it, so they start to spread out more and more and more. And basically, you have a situation where you have, say, a minor spacing, but over 10, 15 years, if gone unchecked, you could have an unhealthy situation like this. So now we have these two really extreme situations. We have really crowded teeth, we have really spaced out teeth. Why, from a dentist perspective, do I want to correct this? As far as I'm concerned, like I mentioned, I am not interested so much in correcting the cosmetic value as I am in the health. So what I want to do with these is bring them to an optimum position where they are of ideal health. So your gums are at ideal health, your teeth are in their ideal health, you are being able to keep them clean, etc. So as far as a cosmetic dentist is concerned, that is all I would want to do, is get these teeth to a position where you can keep them clean, where they are not putting extra pressure on each other, and you're not having general breakdown as a result of it. So like I said, my treatment as a cosmetic dentist would focus more on the health aspect of your teeth. The aesthetics happens to be a side benefit. So what happens when the teeth are in their optimum healthy positions and their relationship to each other is that they end up looking good, because that's what nature thinks is best. So we have these beautiful smiles that we've seen among stars and such, where you notice that they're more pleasing than certain others. A lot of that has to do with how the teeth are positioned, where they're positioned, how small are they? Are they too small? Are they too big? All those things that So mentioned earlier. With broken teeth or misshapen teeth or any of that. So when I bring my teeth or the patient's teeth to an optimum health, the aesthetics is always a side benefit. It ends up just looking good. So let's talk about, I'm actually going to take a little break here and see if there are any questions so far that have come up. And then perhaps.
Yes, Nipa, we can certainly do that. I can see the questions coming in. Yeah, and I think that way we could also connect with the participants better and see, what are some of the things that are running in their mind already after hearing you so far. So let's start with the first one, which says that I have a temporary bridge. Should I go for permanent bridge, or my dentist is calling me for appointment? So the question is a temporary bridge. Should I go for a permanent bridge? And my dentist is calling me to go for the permanent bridge. So that's the question, I think, kind of a dilemma, and wants to find out from you
Sure.
what, yeah.
And great question, because I can understand that in the time of COVID, you are especially concerned about whether it's safe to now go visit the dentist. So firstly, let's talk about what a temporary bridge is. A temporary bridge is made of plastic and acrylic, and it's really not well fitting around your teeth. So given that if it was done, let's say before COVID, then you've had it for at least 3 months. So there is bound to be leakage under the temporary bridge. Because plastic doesn't fit as well to the teeth as, say, porcelain or steel or something else would. So right off the bat, you do want to get it replaced. Now, to your unspoken question about whether it's safe to do it at this time, let me assure you, yes. All us dentists have undergone very severe training with ADA and such, where they've shown us how we can use protective equipment to protect ourselves and our patients. How do we sterilize in between patients? Some offices might even take temperature checks, etc. So in fact, it's probably safer now than it ever was to visit your dentist, because everybody around is a lot more vigilant, is a lot more educated, and wants to do the right thing. So, in order to prevent further spread of this disease. So yes, it is absolutely safe to go visit your dentist now. Starting June 6th, we did get the okay from the county to start practicing. So I would recommend that you get your temporary bridge replaced with a permanent one, because that's, in the long run, that is what's safest for your teeth.
Thank you, Nipa. That was very comprehensive, and I'm sure the answer is something which will help. Next question is very interesting. It says that what age is too late to fix spaced out teeth? Okay, to fix spaced out teeth. My cousin has teeth that have too much of gap in between. He's almost 40. What do you say to that?
So thank you for that question. I'm glad you asked it, and I will be addressing some of the treatments a little later in this. I am talking about what one can do with that. But in short, no, it is not late. We've had patients 60, 65, 75, just before they get their implants done. They want to bring their teeth to an optimum position. Also, who get treatment done, and I'll talk about that as well, because that also increases the longevity of their implant treatment. So will it be as effective as a child undergoing certain treatments? No. There are limitations. However, the products that we have today have worked around these limitations, and some of the very common, at least the cases that I've shown you in the pictures, are very easily treated with the products that we have available today. So I will, if Somit, if there aren't any further questions, I can move on to the treatment, but if not, I'll wait.
There is one question which is actually getting to treatment. So what I'll do is I'll hold that question. Okay. And I think you're already occupying the screen with your slide. Why don't you go ahead? But this participant, I'm just requesting him. This is absolutely a great question. And we'll just hold it and we'll continue after the rest of the presentation from Nipa. So go ahead, please.
Perfect. So now, what are some of these treatments that we can do to correct some of the issues that I showed you? So number one, like I said, cleaning, just keeping your teeth healthy, right? Seeing your dentist every 6 months, getting your checkup done. If there are rotted teeth and large cavities and such, from a health perspective, that's not good. And then obviously not from an aesthetic perspective as well. So visiting your dentist at least twice a year is extremely important, and getting your cleaning done is the basic thing you can do to help yourself. Now let's talk about slightly more advanced treatments to correct some of those issues that I've mentioned. So in very severe, crowded, and spaced out teeth, like I mentioned, what happens is that the interrelationship between the teeth affects the entire bone, the teeth breakdown, etc. So now, obviously, our treatment would want to focus around how do we reposition these teeth? Can we reposition teeth? Can we change the relationship between the teeth so that they're not harming each other? So let's talk about the absolute basic treatment that one can do to change the positions of your teeth. So in dentistry, it's called orthodontics, and you've all heard of orthodontists. What the basic thing that you use, and now even adults use it, is something called braces. What those are steel or porcelain wires and brackets, and I'll show you pictures, that can treat crowded cases, spaced out cases, rotated teeth, teeth that are too much into your gums, teeth that are just severely positioned way in or way out or spaced out or whatever have you. And quite simply put, it moves teeth. All right. Let's talk about what are the different kinds of braces if you are considering it for your children or grandchildren. The very basic are these metal braces. And if you want to go slightly more aesthetic, then instead of the stainless steel, you have porcelain as the brackets. The wire is still usually steel, but the brackets are porcelain, so it's a little more aesthetic. These are the absolute basic braces which orthodontists are the ones that treat your children for. What exactly do braces do? What braces do is they put pressure. So based on where this little bracket is placed and based on how the wire is placed, they put sustained pressure on the tooth. That sustained pressure helps move the tooth because of some bone changes that occur as a result. So now let's say this tooth is sticking way out. So then your orthodontist will put some extra, heavy steel wire, and then they'll put this pressure. And then obviously you might have heard that the treatment goes on for a year and a half, 2 years. In that period, the tooth starts to move because it's just a lot of pressure being applied over a period of time. So simply put, that's all orthodontics is. It's just sustained pressure applied in a particular direction over a period of time. Now, this is something that most adults will not prefer to do. A, for aesthetic reasons. B, it's painful. It's hard to clean. It's fixed. If you have, a wedding to go for or whatever have you, it's typically harder to deal with these. Do we have another option for braces? Yes, we absolutely do. So, about 20, 25 years ago, maybe more, we had our first company that came up with what they call removable braces. And they look like this. So they're not plastic, they're some patented material. But essentially, you put them in your mouth for a period of 20 to 22 hours, and it does exactly what the steel braces do, which is apply sustained pressure over time. So, and based on how these are designed, they will put the pressure in a particular direction and move the teeth in the direction that we want to. There are lots of players now in this. Invisalign remains, I think, the number one in the market. Then there are clear braces, there's Bright Smile, there's this, that. There are quite a few of these removable braces that are now out in the market. What do these do? So let's see a video that will show you what exactly Invisalign or any other removable system does. Okay, this is Invisalign, but some of the other removable systems can do this too. Okay, so you have this person with crowded teeth. This is how the teeth will be moved. And you see the result. Before and the after. So to the earlier question about whether one can do this as an adult, here is your answer. Yes, you absolutely can. These removable braces system, Invisalign in particular, was designed mostly for adults. Now, of course, teenagers use it as well. And what it does is what I showed you is you take your current situation. We have a 3D image of it. As a dentist, I would sit and you know, play with that system and decide how I want the teeth moved, in what positions do I want them finally, and then this is your result. And this is with the Invisalign system. So. And this can be done with spacing as well. This is a crowded case, but spacing is actually a little easier than crowding to correct. So to again recap about braces in particular, what braces do is they change the position of your teeth. So if your teeth position are the issue where you can't clean your teeth, where you're getting all these breakages, then as a cosmetic dentist, that's what I would recommend, that your teeth need to be moved to their ideal positions, because that would be how we would go about correcting everything else that has happened as a result of these teeth not being in their right positions. And with that, we have either braces or Invisalign or any other invisible braces system. Typically the treatment lasts for about, that treatment would probably be about 8 to 10 months that we just showed you. You have to wear it through the day, but the advantage is that they're removable. So if you have a wedding to go for, or you know, you have a presentation at work and you just don't want to wear it for an hour, you can do that. You know, so and there are a series of what they call aligners, where these plastic, you have to change them every 2 weeks or so, and the teeth are moved. So so that's as far as the braces treatment is concerned. I am going to stop here before I go to the next treatment, in case there are any questions around what I just talked about. Now let's talk about what happens if someone just doesn't really want to go through braces, because that's a lot, or doesn't want to you know, change their tooth position or any of that. Here we have this particular person who has some minor gaps in their teeth, but you can see the damage that these teeth have sustained. They're very thin, they're broken, they're uneven, etc. So now this person wanted to undergo some other form of cosmetics. So it is what we call a dental veneer or a laminate. So what you don't know is that these are porcelain leaves that are placed on top of the tooth. It looks just like your teeth, that's shaped like your tooth, colored like your tooth. It closes the gap, it's extremely aesthetic, and can mimic putting the tooth in their more ideal position. So simply put, if someone has seen how fake nails are put, you know, you might have this short stubby nail, and your manicurist or whoever puts like this pretty nail on top, they shape it up, they clean it up, and then they can color it as they want. It's a pretty similar concept. Where we can, you know, we roughen the tooth a little bit, and then the lab makes us these porcelain leaves, and then they're bonded to the tooth. It's a chemical bond, so it's usually very hard to remove them. So you can eat apples and such with it as well. For example, this person had spacing. You can see, and if they don't want to undergo orthodontics, then the next best thing is laminates or veneers. So you can see how They got these veneers done. Not only were the veneers closing the gap, but they also made the tooth a little longer, which is a lot more aesthetic for this particular person. Plus, you can make them whiter. So if someone says, I want my teeth color changed, okay, we'll make it a little whiter for you. So there you have it. This is how the tooth is usually prepared. So underneath, so when you have a tooth like this, we roughen the tooth in this respect. This particular person has a gap between their two front teeth. And then we get the porcelain leaf, and it's bonded here, and it closes the gap. So that's as far as cosmetics is concerned. I'm going to show you just very quick some celebrities that have had. In fact, if you open any celebrity's smile, most of them have had either veneers or some form of dental treatment done. But let me show you the most obvious ones that without dental cosmetic dentistry, they would not be the celebrities they are today. So number one, of course, everybody knows Tom Cruise. We have in dental school, these cases are stuff of what they educate us with, like how they went about changing this smile from this to that. And it's still not ideal, but it's pretty darn close. And he's undergone multiple treatments, including braces, veneers, some minor surgery, etc. So obviously you can see the huge difference in the looks and the smile and everything else. Here's Cristiano Ronaldo. You can see he's missing teeth. He was born with a missing tooth. So you can see that, and with short stubby teeth, misshapen teeth. How do we correct it? He's obviously had veneers done. These are veneers, and he's had them probably from molar to molar, from that tooth to that tooth. Plus they did some minor gum surgery to make his teeth longer. So again, you can see the huge difference in the smile. Priyanka Chopra, you can see she had these really short stubby teeth. Some of these teeth are hidden, and now you can see how the present dentist has changed them to longer, and in the back you can see the huge improvement in the smile as a result. And of course George Clooney, same thing, very short, misshapen teeth, all worn out, and then here are veneers. So again, cosmetics can do a lot, but of course it needs to be done the right way. So